QuickCare is a system of clinics that Aurora has that are strategically placed around the city and the greater southeast part of the state, staffed by what we call advanced practice providers, which are a combination of nurse practitioners and PAs that are highly skilled and are very competent to see patients. The benefits of the QuickCare clinics are their easy accessibility for patients. They're open helpful hours. They are less expensive than other types of medical care and can handle a whole wide variety of medical problems. They have a specific set of medical problems, but the list is fairly extensive. Most of them are open 7 days a week, some 6 days, but they tend to be open all day. Once again, the cost is something that is very important these days for our patients, and that's one of the primary goals of medical care through the QuickCare system, is to keep the cost down for patients so we can assist them in that regard. All these clinics are staffed by what we call advanced practice providers, nurse practitioners, and physician's assistants. All these providers have had extensive medical experience. They work very well with patients. They're highly trained, and a combination of training and experience makes them extremely competent to take care of the types of patients that they see. All of them have had clinical experience with patients, and they are not hired unless we feel comfortable that they are well trained and can work independently for the types of problems that they will be seeing with patients. I think it's important that the primary care physicians understand that the types of illnesses and injuries that are cared for in QuickCare have a fairly limited scope. We do that so that our advanced practice providers remain very skilled in those types of problems. Take care of all types of upper respiratory conditions, mild intestinal problems, urinary tract infections, rashes. And our QuickCare website can go into that in more detail if physicians would like to look at those types of problems. But there are quite a few things that these advanced practice providers are skilled in caring for. One of the things that I'd like to incorporate into our QuickCares is a sense of our physicians understanding that our advanced practice providers can actually contact a given physician about their own patients and discuss their care. And I've encouraged our advanced practice providers to start doing that more if needed, so that our physicians know that the care of their patient is their greatest interest. So when a patient presents to a QuickCare clinic, the advanced practice provider understands the importance of understanding their past medical history, their medications, allergies, and that's always assessed. So when proper treatment is rendered, those things are in proper consideration. One of the messages that I would like to get out as the medical director for QuickCare is to our physicians. I would like them to know how competent these providers are in the QuickCare clinics. Our advanced practice providers all have had extensive clinical experience. They are well-read, well-educated. They, in the QuickCare clinics, take care of a fairly narrow spectrum of problems, but I would like our physicians to understand how competent they are, and I'd like them to understand that they can feel very comfortable sending their patients there for last-minute appointments if their schedules are full. Our providers in those clinics do a very good job of communicating back with the private physicians. All follow-up visits that might be needed are always sent back to the primary physician. Our follow-up and feedback and satisfaction has been very high. All our patients are called back by the staff within the first day or two, literally on a 100% basis, as a courtesy as well as out of concern for the patients. And we're very proud to say that the patients have been very satisfied and been very happy with their care there.